back to the pre-admission game. It's wonderful to have you listening now that we're in the home stretch for interviews, as we mentioned in our previous episode. Today, as promised, we're going to deliver, and we're going to deliver on a teamwork station. So what we're going to talk about is 3 specific types of teamwork and conflict resolution stations. Mitch and I are going to discuss how you should approach each of these stations, and I think most importantly, we're going to discuss what these stations are actually assessing. How should you demonstrate the skill in the station? So I think we should start with that elephant in the room, don't you, Mitch?
Yes, absolutely. So I suppose, what are they trying to assess in a teamwork or conflict resolution station? Now, I think it's not that you are a team player. I mean, obviously, it goes without saying that if you're entering medicine, you ought to be a team player.
So just to be very clear, if you answer a teamwork station by being incredibly hostile and confrontational, you're probably not answering it correctly. I'm going to go out on a limb here.
Yeah, well done. That is true. But also, in terms of things that they are trying to garner, they're trying to work out, are you a good communicator? Are you someone who can understand, that people have different circumstances and not everyone is always going to be firing on all cylinders at all times? Are you someone who
And that could include you, by the way.
Absolutely.
Yeah.
Are you, so I suppose you could say, are you realistic? Are you a person who's had sufficient experience in life that you know when that people are not always going to be, giving their 100%, and you're accepting of that. But that being said, you've had sufficient life experience, I suppose you could say, to be able to overcome these barriers and still achieve your goals.
Absolutely, because working in a team, it's a wonderful thing. In the sense, you get to bump your heads together and come up with a solution. But you've got to remember that we always put a very positive spin on teamwork. Teamwork is fantastic. Teamwork can solve all the problems. But a team of people who are working together incompetently, or people who disagree with each other fundamentally, is far worse than a single person, with a sort of dogged one-angled perspective.
Yeah, right. Because a team that's working well together can synergize, compensate for each other's weaknesses, and really, become more efficient. And that's why, you would get more people working together rather than, just have one person working in isolation all the time. But having said that, if the team is antagonizing each other, if they're not working together properly, then as you said, it won't be efficient. And I think that's exactly why, in medicine being such a team work-focused profession, not only are you required to work with patients, but you're also required to work, as previously said, in this multidisciplinary team with not only other doctors, but also nurses and other allied health professionals. You're constantly engaging with these different people which have different ideas, different strengths and weaknesses, and different values. So you really need to be able to be across all of this and come to some constructive solution to any issues so that you can get back to that state of synergy where, ultimately the team's doing well and patients are benefiting as a result.
Absolutely, and that's key, right? Because the scenarios that we're going to present to you today are usually quite banal, everyday, team project scenarios that you have a bit of a challenging time at work. Maybe, you work retail and you have a bit of a conflict there. The stakes in those scenarios are significantly lower, with all due respect to whatever it is that you're doing, are significantly lower than they are in the hospital, right? Stakes of poor team communication, teamwork in a hospital is patient lives. Stakes of poor communication in the McDonald's drive-thru is somebody doesn't get an extra slice of cheese in their cheeseburger, right?
Absolutely.
So
you can imagine if there's any hostility in a team, that does mean patient safety.
Yep.
So it is part and parcel. Good communication and team conflict resolution is it's as important as understanding differential diagnoses and ordering tests and things like that. It is 100% grade A medical material here.
Absolutely.
And they will continually assess this in you, as you move through your medical career. So make sure that you're thinking about this kind of thing. And I think we've also taken a mnemonic for this situation, for this talk today.
A couple actually.
From things that we ourselves have used for our own applications to hospitals. So this is a very high yield.
Exactly. You're going to be introduced to your first medical mnemonics today.
Welcome. Okay, Aaron. So to begin with, would you like to start us off with talking about how you would approach situations and tasks in a group?
Absolutely. So today we'll talk about 3 different types of teamwork conflict scenarios. The first type of teamwork station is actually an open-ended experience station. Rather than presenting you with a scenario, they will actually say, okay, Mitch, can you tell us about a time that you worked in a team? right? And everybody, for some reason, this causes this panic in students because they think, oh God, I have to talk about the time that I volunteered in this homeless shelter while running a lab on the side, something really, really complicated and multifactorial. The reality of the situation is starting with your medical admission interview, going all the way through to even your internship interview, right? Because they're assessing core skills and not your resume. Remember, they have your resume already. They're assessing core skills in communication. You don't have to come up with a fancy scenario. It's the evaluation and analysis of the scenario that matters. So if you've worked in retail and had a stressful teamwork experience, that's fantastic, right? If you've worked in volunteer capacity, if you've worked in anything, a banal situation, if you worked in a committee, a university committee, that's also fantastic, right?
Yeah.
It doesn't have to be some complicated, research lab, medical, volunteering situation.
Because it's not so much the situation, but your assessment of that situation and, how you address the situation and how you came to a resolution. That's the important part.
Absolutely. So the mnemonic that we use, the first of many mnemonics to come today, is the STAR mnemonic. So STAR. S in STAR stands for situation. The first thing you have to tell your examiner is what actually was going on. You need to give the bones of the scenario. We don't want all these details about what day of the week it was, how many hours you were working, just the most salient points.
Absolutely. Imagine it's a long story short, and then your situation.
Exactly. Yeah, absolutely.
Don't take up too much time. Often you'll only have 1 minute 30, 1 minute 40 for your medical station. So really smash out that situation. So the examiner is oriented to what you're talking about.
So for example, if the teamwork environment that you're describing is some sort of competitive sport, you need one sentence. I was playing at this level, this particular sport. That's all you need. Right? The reason why I say at this particular level is because if you make your scenario specific and a little bit formal, it makes it seem less generic. Obviously, generic is the opposite of formal and specific, but it gives your scenario more color. It makes you seem more professional, and it sort of compensates for the fact that you only have a minute to get a clear picture across. So that's situation. Right, okay, do you want to take over for task, Mitch?
And I suppose with that situation, just to add just one final point, you want to talk about who was involved as well. Obviously, because it is a team workstation after all. So, I was doing, as you said, X something at X level, and
with these people
involved, and this was the issue.
Very short, and it shouldn't be longer than that. That is really the length that we're looking for.
Absolutely. Then you get onto the task. So, it's what was the issue? You really want to drill down quickly into what it was that caused the issue within the group. And again, it's kind of, I suppose, painting. It's still background information for the examiner at this stage, because you haven't really said, what you did in response to this situation, but you're trying to paint a picture of why it is a salient teamwork scenario that you're bringing to
and
the
forefront. Task has to be as specific as possible. So we're not saying, we had a really big day ahead of us. We had a really difficult job to do this day in the McDonald's drive-through. That is not a specific situation. That's arbitrary. What I'm talking about here is, for example, we were understaffed, right? Or we had an ideological disagreement about which way the team project should be developed. Right? Or, for example, some members of the team believed that they were playing sports casually while other members were playing at a more professional level, right? So all of these things show a dichotomy, right? Or a challenge that you had to overcome in very specific terms rather than sort of, we had abstract challenge. So specific situation, specific task ahead of you.
And I think that you talked about ideology as a sticking point, which can be an issue. And I think that's a really good one to bring up. If you are thinking, is it better to talk about a time that we're under the pump at work versus a time where I had an ideological disagreement with someone? And I think the important part with that type of situation is that you have to understand the person in order to come to a resolution. We'll come to that later, but I think that in thinking about your task and the complexity or the factors that are making the situation complicated, that is good because it's going to demonstrate some of those essential factors that they're trying to work out if you have for selecting future medical students. That ability to empathize and understand people.
Absolutely. And now that we've touched on sort of ideologies, the other thing that I want to point out too is that try and make these scenarios sort of professional. What I mean by that is the argument that you had last week with your sister is not a good case study for this situation. It's too isolated. It's too specific. It's not It doesn't put you in a professional context where there's all, the multitude of complicated pressures acting on you. So those sort of scenarios, or maybe an argument that you had with a friend.
Absolutely, because ultimately this is a professional interview,
Exactly,
isn't it? So,
exactly.
How you behave in your private life, is I suppose it's not really relevant here. What we're trying to just talk about is professional circumstances, times on committees, as you said, and that's why this situation is important.
And the other thing, sorry, you just reminded me of times on committees. The other thing that is good is, as a general rule, when you apply for things, university and beyond, especially after undergraduate, you've had 3 years, a couple of years of undergraduate, people don't like to look at your resume before the age of 18. What I mean by that is everything that you did in high school, sort of be very careful with how you use it, right? If you were, cross-country champion in year 9, right, that's a little bit dated at this point, right? And the only thing that serves to highlight, apart from the fact that you may have been a good runner at one point, is that it exaggerates. If you have a lot of stuff in high school and then nothing in undergraduate, like absolutely no work, nothing at all, it serves to highlight that gap. You're looking at that resume, you're telling a story, and I'm thinking, okay, well, what has this person been doing for the past 3 years? So to be perfectly frank, if you have a good retail or society experience, doesn't have to be anything fancy, right? And maybe a good high school experience in year 10, I would always be opting for something that occurred at a more senior level. It's more sophisticated, more complicated, and it shows that you've continuously been engaging with the world around you rather than being sort of a recluse studying science.
Unless you are an undergraduate student who's applying to undergraduate medicine.
Of course, absolutely.
Those people are more than welcome to talk about their high school experiences.
In fact, encouraged and necessary, right? That was a comment exclusively for postgrad. I forget our audience is quite diverse, isn't it?
So I suppose the next thing that we're brought to is this action. So I suppose, Aaron, tell us a little bit about action.
Absolutely. So oftentimes when you're faced with a challenge, you do something and it's not always the right thing. So you need to clearly, step by step, very sort of clinical way, I guess is what I'd call it now, explain what it is that you did and why you did it, right? And it doesn't necessarily have to be good, bad, just to be organized. What I mean by that is the way you should present your action is, first I did this, then I did that, and thirdly, I did this because of this, right? So I don't want a long and detailed narrative about the emotional turmoil that you experienced while confronting this task and this situation. I want you to be very, very clear, because once again, the money is in the evaluation, right, which is coming next. The results, right, and the results in the evaluation are the most important thing. Your action in and of itself is still you setting up the scenario for your examiner, setting up the problem. Yeah?
And I suppose then we come to our result. So, what actually happened? What did you learn from the situation?
So results are what were the outcomes of your actions? What actually happened? Were they successful or unsuccessful? So how did you perceive them? Right, and then of course evaluation. Sorry, I interrupted you. Yeah,
you can. You could talk about how unsuccessful you were as a result, but I suppose if I suppose the caveat to that would be that if you were unsuccessful as a result of communication breakdown that you were unable to resolve due to your lack of communication skills, maybe that would be less good to bring up.
Oh, of course, you have to balance it. So it may be if you were completely unsuccessful, you should say, perhaps our team meeting or the actions we took did not completely resolve the situation, and I realized that next time I will do this, this, and this. You have to remember that if you implement some sort of action and then the result is absolutely disastrous and that's where you leave it, from the perspective of the doctor or nurse or member of the public that is looking to take you on into the course and eventually into the hospital, they're thinking, Jesus Christ, this person is just a liability, right? So you don't want to set yourself up as a danger to the healthcare system.
Absolutely. So, moral of the story is if you were unsuccessful, that's okay. But make sure that you have good reflections and you're able to demonstrate, how you would do things differently in future.
Absolutely. So just to recap that's STAR, so S, situation, T, task, A, action, and R, results and evaluation of consequences.
And I'd love to take academic credit for that, but it's freely available on Google. It's been can't reinvent the wheel. It's been done many times.
Absolutely. I think we should take academic credit for partially contributing to the medical education of our listeners.
We're popularizing it.
Absolutely. We're popularizing it. We're going to save lives. People are going to implement this. It's going to change the world.
Okay, everyone. So we've discussed the STAR.
Now that we're done bragging, yeah.
We've discussed the STAR framework. Now what we're going to discuss is is talking about
team projects.
Right? So this is a situation where you've had to work in a group, and it's a common interview question where someone is not necessarily pulling their weight.
Yeah.
And I think that's something that's a good postgraduate or even undergraduate level question because, in many cases you've already done group work. And
you've already learned to hate it.
You've learned to hate it, usually because there is one or more particular individuals who are potentially not contributing as much as you conscientious pre-meds were.
Not everybody cares about their average mark or their
Absolutely. Not everyone
exactly.
needs to maintain those HDs for that GPA.
Yeah. So usually the way this question is phrased is you are working on a project for your undergraduate studies, or I guess for undergraduates it would be in your high school studies, and this project makes up a huge component of your final mark, let's say 80%, right? And a couple of weeks into this project, you're working with a team of 4 people, and one of the students is consistently not showing up for meetings and not meeting deadlines for their part of the assignment. And the questions are usually quite open-ended. It says something along the lines of how do you approach the situation or how do you manage the situation?
Absolutely.
And I think that oftentimes we have all this pent-up anger and frustration from our time working on these group projects that we have a tendency to knee-jerk.
Yeah.
But again, you've got to transplant your mind into the clinical setting and think, okay, if I'm in the clinical setting and somebody in my team, maybe it's a fellow intern or some other staff member, is not doing the things that I'm asking them to do or that are asked of them, it may very well be my fault for not understanding where they're coming from, for not communicating clearly, right? For not being an active member of the team myself.
Definitely.
Yeah. So you always got to look at yourself first before you start, come out guns blazing.
And I mean, this type of question can also be, to draw a very long bow, but it's also you and a patient are also on a team in some ways as well in a therapeutic relationship. So, think about the time that a patient, might not take your advice necessarily. You're not going to go out guns blazing, annoyed at this patient. You're going to think, hang on, is there something that I've done wrong in talking to this patient? Have I misexplained something? Has there been a breakdown in communication somewhere along the line that needs to be rectified, with a clear, clarification?
Yeah. If there's a straightforward treatment that you're proposing that's going to 100% help the patient and they're rejecting it, first place you should look is a mirror because you're clearly not doing your job as a clinician, or at least certainly at our level. I think as medical students and interns, we're certainly not doing our jobs.
I'm sure it's very complicated.
Yeah. Not to denigrate anybody who's much our senior and certainly knows more about this than us.
But to take it back to that situation of the clear-cut team where someone is perhaps not pulling their weight. We've talked about self-examination. What would you do next, Aaron?
Okay, so after you've reflected, I think the first thing to do is act on that reflection, and that means we need to, well, first of all, we should probably check in with this person. You don't know what's going on, on their side of the pond. You don't know what the reason is for them not delivering on this project. It could be anything. It could be they're having a hard time at uni, they're going to have a hard time at home. Maybe they disagree. Maybe you've been dictatorial and you've assigned people all this work and their chunk is the hardest or the largest and they're really struggling to complete it on time.
Yeah, maybe you've been working really hard as a manager.
Right.
As a bossy
and not a team member, yeah.
And haven't done any of the work either.
Exactly, hogging the limelight.
So, and I think by talking to this person, you're also demonstrating to the examiner that you are able to, to show good communication skills. Someone who just gets mad and goes and reports the person, isn't showing that they're able to self-resolve issues. And I think ultimately that's a sort of a black mark.
That's skill set, right?
Exactly. That's a black mark against sort of professionalism. You need to be able to solve things yourselves without involving senior management, or they're going to be continuously caught up with trivial issues.
Exactly. A boss hires somebody that can do the job, not somebody that's going to be constantly pestering them with, can I do this, can I do that? So, and the mistake that people make is when they talk to this person who's not being a team player necessarily, they come out with some like obtuse remark as, I've just noticed you haven't been pulling your weight on your team. That's not checking in with the person. That's accusing them. That's straight up an accusation, right? So when I say check in with a person, I mean ask them, are you okay? Do you want to have a chat about the project with Keep it very, very open-ended and really gain their trust and their perspective, right? Find out what has been going on from their end.
Rapport build,
Absolutely.
Rapport build, rather. I mean, it's these things all lend themselves to how you're going to interact with your patients, which is why they are testing them in your medical interview.
Absolutely. Okay, so the next step after you've had a chat with this person is say, okay, look, project deadline's looming, we got to get cracking. So what we should probably do is we should get together as a team and reevaluate, first of all, our vision for the project, second of all, our workload. Are we all on board? Are we all on the same page in terms of what we're trying to do? Because if we're trying to complete 4 different projects as 4 different group members, right, that's no bueno. That's no go. We won't be able to submit that. Secondly, again, if I've, established myself as the alpha team leader and decided that I'm going to make the title.
Self-nominated alpha team
leader, exactly, and I'll write the title for the project and everybody else can write the 10,000 words. That's also a no-go. So we need to get together, we need to get on the same page, right, in the most sort of democratic and open way possible, build that rapport, and usually 99% of the time, I like to mention that this will resolve the situation. That's probably usually people aren't maleficent in their nature most of the time, right? I'd like to believe, right? They don't do things to hurt other people, so most of the time it's all miscommunication.
I'm sure there's a few listeners who are just thinking back to their university projects and thinking, I disagree.
Pretty maleficent, yeah. You got to give people the benefit of the doubt,
right?
Right?
Absolutely. And I think that's a very good point. For the purposes of your medical interview, give everybody the benefit of the doubt.
Like an absurd benefit of the doubt.
Yeah, because you don't want to be making negative assumptions and then find out you're wrong. Because that would just, you'd feel like a real silly person, in the interview if they gave you a follow-up which identified the person to be,
innocent and you're the problem.
And you're the problem,
exactly.
Absolutely.
Yeah, save your anger for your midlife crisis. Yeah, save it. Good, okay, so now that you've had that team meeting, right, hopefully the project should be back on track. But maybe it isn't. Maybe another week passes and the person is still not pulling their weight, is still not submitting stuff, despite the fact that you now know for a fact that you're all on the same page and happy with the project. So at this point, right, we got to start getting a little bit worried because the project is worth a lot, right? And at the end of the day, you have to submit it. You and your team members have to submit it, and you have to get into med, right? So that means you need to maintain your GPA. So,
and I think it's also just to say that it's okay to be someone who wants to submit a high standard of work.
That's very reasonable.
That's very reasonable, and I think medical schools will also appreciate that.
Yeah, exactly. You don't want to let the project crash and burn because a quarter of the team isn't pulling their weight. Absolutely. You still have to get it done on time. I mean, again, in a medical scenario, if one of the team members doesn't show up, you don't just throw your hands up in the air and say, look, sorry, Mr. Smith, you won't be having your appendectomy today.
We're only looking after 75% of the ward today because one of the doctors is not
is not here. That's not really acceptable. So what you have to do is get together with the 3 active group members and create like an emergency contingency plan for how you're going to manage this project. I'm not saying start pulling from the extra team members' workload immediately, but just have a plan in place so that you can still complete the project on time to a satisfactory standard. At the same time, right, you should probably speak to this team member again and say, look, we had this conversation. We felt like we were on the same page, but the project deadline is looming, and we're going to have to start working on some of this stuff.
And I think that the really important thing that you've touched on is that you're continuously feeding back to this person and trying to keep that communication line open.
Never go over anybody's head, ever, under any circumstances. Yeah. So you keep that communication line open, and you probably at this point should mention that, should this partnership continue not working out, it might be worthwhile speaking to a supervisor. And this is not like I'm going to dob you into a supervisor type of situation. This is sort of like we have a problem on our hands. For whatever reason, you're not doing this project, right? And you may have a very valid reason. From our perspective, we need to get the project done, right? We may need to have some degree of assistance. And again, usually by this point, if you have a contingency plan in place, you're on track, right? You've had a second chat with this person. This should normally resolve most of these situations, right? Absolutely. Because you're sort of putting the pressure on a little bit. Beyond this, right? If there's still a lack of input from this team member, what you say is you implement your contingency plan, you start working on the project to complete it on time, you actually put it into action, and you approach this person and say, look, we've had 2 chats, we've discussed this to great lengths. I think we're going to have to talk to a supervisor now. You invite them to come along by all means. Please, we don't want to again, go over anybody's head, step on anybody's toes. And when you do go to the supervisor, the way you should phrase your request is, we're having difficulty with this team. Present them with an unbiased account of the situation, your steps, and the formulation of your question or request should be, can you give us some help? Can you give us some insight into how we should manage this problem? Maybe we need a deadline extension. Maybe we need to reshuffle the team. Maybe this person needs a little bit of help.
Maybe we need a new fourth member.
Yeah, fourth member. Right, but you don't want to come in there with hostility and say, we need to fire this guy, you need to remove him from the university.
Get him off the course.
It's not, again, your priority here is, first of all, everybody's well-being. Second of all, the completion of the project, right? You're not there on some, revenge quest to crush this person that for whatever reason...
Destroy their academic career.
Absolutely.
Because they've, squandered your chances of getting an HD.
Absolutely. That's petty and really unacceptable in a team environment. Yeah, absolutely. Anything to add to that, Mitch?
I think I would say, when you do eventually need to solicit help from, a senior academic or something like that to help with your team, management issue, I wouldn't spend too much time going into that. It's like, it makes sense. They know where you're going with that, when you've hit the ceiling of your ability to control the situation, you would get senior support. And leave it at that. They know what you mean.
Absolutely. And that's key, right? With these hypothetical scenarios, don't go off, into the multiverse, branching off every single possible, eventuality.
Yeah. And if that happened, I would
if this, and if their dog recently died, then I would make sure that I would go to the shelter and pick, like all of these unnecessary complications that
stick to the point.
Yeah, exactly. Stick to the point. Assume that everything goes according to, this flow chart. If then, it's very linear.
And I think, go behind the question. What are they trying to assess? They're trying to assess your communication skills, your keenness to generally engage with people, and your ability to resolve issues on your own as a mature adult. If you can do that and you can demonstrate that, you're doing well in this station.
Absolutely. And in the last couple of minutes, I think we're going to move on to the final, probably a rarer scenario type, but very important nonetheless. And this is like an outright conflict resolution or escalation. I should really call it an escalation scenario. I suppose all of the scenarios so far have touched on escalation in the sense that you've encountered a problem, you've had to analyze it yourself, attempt to approach it yourself, and then sometimes, in the previous case, you had to go to a supervisor. But this, what we're going to talk about now, is explicitly how do you escalate a scenario with a senior supervisor? How do you actually alert them to the presence of what you perceive to be a problem in a way that is respectful and acknowledges the fact that most of your supervisors are going to be very trained, very experienced, and you have a lot to learn from them.
And we've drawn this from our own sort of medical education, around patient safety. So this is a situation, where people may find that someone senior to them is behaving in a way or has done something that may compromise patient safety. Now, it's important, obviously, that you address this situation because if any, harm is going to come to a patient, that is not what we are there for. That is the enemy of all.
It's what we call a big no-no in medicine.
It's, very much a big no-no. But at the same time, the situation will pass, but you still have this relationship with this supervisor. And medicine at the end of the day is a very small profession. You want to be seen as someone who, beyond all else, is someone who's able to remain professional, remain collegial, and to be able to, yes, get the outcome, which is patient safety or, resolving this conflict, but to do so in a way that's respectful and acknowledges, that you may not have all of the answers yourself and you may be completely misguided in what you're starting to think when you do go into this situation.
Absolutely. Having said all of this, I think Mitch is about to introduce our second mnemonic for the day. Right?
Yes. So this one is called PACE.
We had STAR, now we have PACE.
Yes, pace yourself for this one, guys. So that's the fakest laugh of So the first word in this acronym is probe. So rather than going in guns blazing, it's best to start these situations when you're escalating with a question. So can you, if I were to give you an example, Aaron, like I could be giving an antibiotic to a patient.
You might be a medical student on the ward, and I see you.
Let's say that you are a medical student and I am a resident, and I prescribe an antibiotic which the patient is allergic to on the ward.
So just for clarification, a resident is a junior doctor, much more senior than you, but still not a specialist.
Absolutely.
So you're prescribing an antibiotic. Okay, so I think that the patient might have an allergy. That's where you should start. you have some sort of reason to believe that the patient has an allergy. Maybe you have an odd recollection of their medical record. Maybe you can see that they have a red armband which signifies allergy on their arm, right? So I think it's very important to remember that this person is many, many years more experienced than you in training. And yes, there is a chance that they might have forgotten this, but also there's a chance that they might be making a very educated sort of medical treatment step, right? They might be a very complicated risk-benefit analysis that you're simply just not aware of. So in order to preserve your relationship with this person, the way you probe the situation, the P in PACE is probe, is you say, did you know that? Right? It's a question. So Mitch, I'm sorry, but did you know, I think this patient might have an allergy, right? Or did you check the allergy list? Or, did you want me to show you the medication allergies list for this patient just so we can double check? So do we want to recheck the allergies for this patient? Exactly, perfect.
Are we sure that patient doesn't have an allergy to penicillin, let's say? And in most cases, as is often the case, people might say, oh gosh, yes, you're right. Let me quickly check that. Oh, you're right. There is an allergy. Or no, I know exactly why, we're doing this, for this reason. And then you've given yourself a learning opportunity. So everyone wins. You know what I mean? So that's how you, and
you could be absolutely certain that the patient has an allergy, 120% certain, willing to stake life and career on it, and you still do this, right?
Absolutely.
Because it's the polite, respectful way to escalate in this context.
Absolutely. So I think we've covered probe reasonably well now.
Yep.
The next thing you need to do with A in PACE is alert. So, and we're not saying alert the authorities, call the police on this person.
Well, you haven't called the police in the hospital?
Maybe as a child. Accidentally dialing 000. But, so when you're alerting, it's still very graded in its escalation, right? So it's a case of, can we have a look at the allergy chart quickly? I'm concerned this person might have an allergy.
Yeah. So rather than formulating it as a question, now you formulate it as a statement. Still not aggressive or accusatory, but whereas before you said, would you like to look at the allergy chart, right? Now you say, can we please look at the allergy chart? There may be an allergy, right?
Yeah,
you more specifically, more directly address your concern.
Absolutely. And do you see how, you're demonstrating your communication skills here? And I think that, some people might be saying, well, you just said that in the same way. It doesn't really matter. It does matter.
Because you're more assertive.
You're ever so slightly more assertive.
You've taken your assertiveness a grade up.
Yeah.
Why we call this method the graded assertiveness method.
Indeed. So you've alerted this person to a specific thing that you want them to do in order to prevent some problem from eventuating. And remember, we're painting this in a hospital situation, but it could be any situation that you're given. It would probably be better if it wasn't a hospital situation, since that's something that you have no experience currently for those listening at home. But for us, it's something that we know a little bit better, so we'll use it for this example. So the next thing you need to do is think about C in PACE, which is challenge. So again, we're going up the graded assertiveness ladder. Aaron, tell us about challenge.
So challenge, if before we said, could we please check, right? Now you're saying, I think it is unsafe to give this patient the antibiotic, right? So before it was still sort of a little bit of a remark, a little bit of an observation. Now you're being very direct, very explicit, without yelling stop. That's the next step. Spoiler alert, right? You say, I don't think it is safe to administer this antibiotic, right? Yeah. You get directly to the point.
Yeah, absolutely.
I think this patient has an allergy. It is unsafe. I think it is unsafe to administer this antibiotic. Notice that the difference now is, while you're direct, you're still saying I think. Right? There's still an element of doubt and politeness and respect present. The sort of that indicates your concern, but at the same time, you're not jumping to take that antibiotics needle for yourself.
Absolutely. But can you imagine, if you started with that challenge, that could be seen as just downright unprofessional. Imagine if you were wrong and you were barking up the wrong tree.
Probably wrong, by the way.
You are probably wrong. In all honesty, you lack experience at this point, so you are probably wrong. But on the off chance that you're not, it's important that you bring it up. And that's because patient safety is so important. That's, one of the, the core things that we're trying to ensure in hospital environments. So, okay, so we've addressed challenge, and Aaron spoiled the
Sorry,
big reveal.
Guys, yeah. E in PACE is an emergency.
So effectively, this would be when there was some time, like temporal emergency, where you did have to intervene immediately in order to prevent sort of harm from happening to someone. So it would just be, a case of if the nurse was about to inject a patient with an antibiotic you think they're allergic to, just to say, stop, look, I think we need to have a second think about this. I'm really uncomfortable with this. Please stop. This is a safety issue.
This is unsafe, right?
And I think at that point you are maximizing your assertiveness.
So you're actually giving a command here, right? It's stop, don't do that.
And people in healthcare settings are extremely respectful of each other's opinions. If nobody is going to give someone an antibiotic while someone in the room is saying, please stop this. This is not appropriate right now. Even if you are, the most junior person in the room. So I think, it is important, but remember that you need to be graded in your approach to this.
Right. So again, we cannot emphasize this more. You need to go through all of the steps before you get to emergency, right?
Absolutely.
So if you see the nurse needle in hand, or the doctor needle in hand, or really anybody needle in hand, and they're about to administer these antibiotics in this context of an allergy, you always start with probe, move over into alert, then into challenge, and then into emergency, right? Because realistically, if somebody's about to do something and you start talking to them, they will be distracted, right? So you never ever skip any of the steps.
Absolutely.
Right? You don't go straight to emergency, even if you perceive it. I mean, I guess there's probably some 1 in a million scenario that's not relevant to interviews where you would skip to emergency, but in the context of an interview question, you do not escalate to emergency without first doing the previous steps in pace.
And going behind the question, what are they asking for here? They're asking for nuanced understanding of how to communicate. They're talking about professionalism. Do you have aptitude for professionalism? Do you care about the relationship that you have with colleagues? And do you understand that medicine is at the end of the day quite a vertical, hierarchical profession, and you need to be aware of this sort of thing and somewhat accepting of it if you are to sort of survive and do well within your future career.
Wonderful. And after that piece of sage advice, I think we'll wrap it up. Thanks for listening. As always, in the home stretch of interviews, best of luck. Think about this advice, try and take it on board. Do lots of practice questions, and I hope you all smash it out there. Excellent. See you guys.